Hey guys, long time no talk. It's been a really long time, I guess, that I've done one of these transition update videos. I was not very good at updating them through the years, and I'm sorry about that. But I have a big update. Guess what happened? I had top surgery! This is my chest. I believe it's advertiser appropriate now. Probably is, because these are now male nipples instead of, no longer female nipples. How about that? So yeah, as of this filming, I'm 2 weeks post-op. And I'll just give you kind of an idea of how far my scars stretch. Like that. And, yeah. She did do a little bit of sculpting, so I have pecs, which I was not expecting. And this nipple is not real. Well, okay, it's not my real right nipple. It is, a skin graft. Right now it's just a massive scab. And then this nipple is still real. This is my left one. Yeah, there's a little bit of a fold there, which I get to see her on Thursday of this week, so we'll find out what to do about that. But yeah, this is it. It was certainly quite an experience, and I learned a lot, which I am going to share with a few of you, because I know that everybody always does videos on like what to expect, what to not expect, things like that. And yeah, that's kind of true, but I really think that you can't have too many of those out there, because everyone's experience with their surgeon will be different. So yeah, we'll do that. Also, I'm going to put my shirt back on, because it's really cold in my room right now. Okay, we are back, and I'm no longer shirtless. So, first of all, definitely find out if your insurance will cover your surgery. Now, I have Medicaid through the state of New Mexico, and through the state of New Mexico, I have Blue Cross Blue Shield of New Mexico. And it was only fairly recently that I'd say within the last year, or within the last couple of years, that Blue Cross Blue Shield has begun to cover top surgeries for transgender individuals, or non-binary individuals in some cases. So, definitely look into it. Find out what they need. Now, my insurance required a letter from my therapist or a psychiatrist, so any sort of mental health professional, and either your general practitioner, or your general physician, or your endocrinologist. And I got mine from my endocrinologist, who I've been with since I started T back in December of 2000. Wow, December of 2015. Like, that's coming. That anniversary's coming up soon too. But definitely find out what you have, what information you need, and then make sure you have more than one copy, because you never know if you may have to submit it in person, if you have to email it, if you have to fax it. Make sure that you have at least a master copy. And if they only give you like a physical copy for your master copy, I would recommend scanning that into a computer, so you have a digital master copy as well. The second thing is, after you submit your paperwork, I know that the temptation is going to be there for you to just like messaging them every day and going, well, did you talk to them? Did you talk to them, doctor? I don't recommend doing that every single day, because one, that's kind of impolite, and two, it can really, it could possibly mess up the process. You don't know. I would recommend checking in at least once a week, maybe, if you're that anxious about it, once a week. If you're not, at least every other week, maybe once a month, depending on how long it might take for your insurance to go over the paperwork. Now, in my case, things happened kind of quickly towards the end there because I found out that my surgeon is retiring in December. And at the time, we thought she might be retiring in October, and it was August. So we had to come up with something fast. So I got both my letters, I submitted them, and right after I got back from visiting my girlfriend in Seattle, which was mid-August, the scheduler at my surgeon called me and said that my insurance had approved them, and she just had to wait for my surgeon to approve the dates. And the week that I got hired for my AmeriCorps job that I'm at now, the very same day, my top surgeon called, and I got scheduled for the 6th of October. So, number 3, make sure you get your paperwork talking about what blood work you need, what tests you need. I had to go get a COVID test. I had to do it twice because the first time I showed up, they wouldn't have given me they would have done the test early, and then possibly the hospital wouldn't have done my surgery in the first place, and that would not have been good. So I had to take care of that twice. Then I did my blood work 72, no? I did my blood work the week before, and find out if they're doing a full panel. They did a full metabolic panel on me, including, I think, even testing me for STDs and stuff like that. So, definitely make sure that you know where that's going to be. You know, get a ride scheduled, if you're driving yourself, make sure you arrive in plenty of time, especially right now with COVID. Find out what the lab that you're going to, find out what their procedures for COVID are. If you need to, if only you can be in there, if you have to have your mask up to a certain point, if they do temperature checks at the door, things like that. It's good to be prepared. As far as the COVID test goes, you need to get that right now, if that's what's happening. If you're going to be getting your surgery during this pandemic, however long it takes for everything to go mostly back to quote-unquote normal, make sure you get your COVID test. They want it 72 hours before, usually, so that's about, I got mine on a Friday, and my surgery was on a Tuesday. No, you got yours on a Saturday. I got mine on a Saturday, and my surgery was on a Tuesday, so that gives you an idea. So, like, if your surgery's on a Monday, you'll want to go on a Friday, etc. So that's the third thing. 4, make sure that you have a pregnancy pillow or 2 large body pillows. And I'll tell you why here in just a minute. You're also going to want an airline pillow. The ones that go around your neck. Those are useful. And if you can get it, I had a very generous friend who sent me a pillow, a mastectomy pillow. It's where it's a pillow where you tuck it under your arms, and it kind of pads your chest so you can kind of be a bit more comfortable. Definitely, I would recommend getting one of those. That one is not as much of a have to get as, say, the pregnancy pillow or the 2 body pillows, but it's definitely a good idea. The other things you should get are compression socks and button-down shirts. The compression socks are going to help you because you're going to be off your feet for anywhere from a week to 3 weeks, depending on your recovery time and how you heal. And those help keep blood clots out of your legs, obviously. They're important. Also, they're pretty warm. To be honest, I'm wearing a pair of mine right now because it is cold, and my feet are warmer that way. So, and the button-down shirts are going to help you because, as you saw on my chest, now my chest is 3 weeks post-op. But for the first week, I was in a medical tape binder that was from here to here, all the way around my back. And I couldn't do anything. I couldn't shower, I couldn't lift, I couldn't do anything. So I had to and I couldn't pull a shirt over my head. So I had button-down shirts to be able to change into. It's a really great idea if they're secondhand, because then they're super duper soft and comfy. And I still have all of mine, and for now I'm planning on keeping most of them because they're really comfortable. So, number 5, make sure that you have access to a lot of liquids, that there's easy to make food, whether it's for you or your caretaker. By week 2, I was able to get up and use the microwave. Heck, I think I was even able to use the microwave, within the first week? Something like that. But you don't want to cook. You know, you can't lift, you can't do anything. So, taking something, a little microwave dinner out of the freezer, putting it in the microwave, and heating it, that's going to be good. Snacks are good. Crackers, cheese, Gatorade, sweets if you like them. And watch your sodium intake. Your doctor might put you on a pre-op sodium intake. A pre-op sodium, low sodium diet. Definitely, that's goes back to reading your pre-op paperwork, or if you have a pre-op appointment. I didn't. I think it was probably just to help minimize exposure because of COVID and everything. Everything I needed to know was on everything that I needed to know at first was on my pre-op paperwork. Now, I also got a phone call from a pre-op nurse who told me everything I needed to do, including washing with antibacterial soap. So, my next bit of advice is listen to that nurse. They know what they're talking about. And I recommend doing pretty much everything they tell you, almost to the letter. Obviously, if there's some practical things you have to figure out, you can do that too. But definitely listen to them because they know what they're talking about. Also, triple check what time your surgery is. I could have possibly shown up for the wrong time and not have been able to go into my surgery at all. Because the hospital told me one time and my surgeon had told me another. So the Monday before, my partner and I spent this fun time trying to be like, oh my god, what time am I supposed to be there? Everything like that. So make sure that you triple check what time you're supposed to be there. But also, one bit of advice I could also give is that try to be gentle with yourself the day before. Don't do anything too exciting. You know, try to go to bed early if you can. You know, maybe take some time to chill out. Don't do anything too exciting if you can. But to sum up, number 1, make sure you know what your insurance requires. Number 2, don't bug your surgeon too much, but if you're going to, only do it like once a week, every other month, or once a month, depending on how things go. Be aware of all of your pre-op paperwork and procedures, whether you need to have a blood test, a COVID test, and you have both. Be aware of the COVID procedures for both places. Number 4, make sure you have a pregnancy pillow or 2 body pillows, button-down shirts, and compression socks. And those are all fairly affordable, and a lot of times, even if you reach out to people in the trans community, maybe some guy has stuff left over from his surgery. I kind of lucked out in that regard myself. Number 5, do everything you need to do when they say to do it. Number 6, read your pre-op paperwork and listen to the pre-op nurse because they know what they're talking about. And number 7, the day before, try to relax, try to take it easy, go to bed early if you can. Oh, and number 8, which is kind of out of sequential order, but make sure you have easy to eat and make food. Microwave dinners, soups, sandwiches, snacks, plenty of liquids. And I guess number 8, don't annoy your spouse. So, yeah, that's it for this one. I will be making a part 2 and giving you guys some more information about how to handle your surgery the day of. So, thanks for watching, and I'll see you later.